don't fall for all those photos. Even though the person looks amazing right away and they have the most defined jawline ever, they're going to start looking boggy and heavy later if you put too much. 2 seconds between patients. I just want to talk quickly about neurotoxins, meaning Botox and Dysport, that kind of stuff, and fillers around the jawline and mouth. And the main reason I want to talk about this is because I've seen a lot go wrong recently with fillers in this area as they become more popular. So I'll just kind of quickly go over Botox and then we'll get into filler really quickly. I just drew a little sketch over here. So you can see this is where we place Botox on most people. So a lot of patients, they need Botox around the mouth, and there's different areas to place it in general. For the lower mouth, we have the Depressor anguli oris, the Depressor Labia Inferioris, and then we have the mentalis, and we have upper and lower parts of the mentalis. Now, the reason people in these areas get depression is they get some volume loss over here, and they sometimes get hypercontracture. This is more pronounced in people with prominent dentition. So if you look at my mouth, when I close, my lips just go back together very comfortably. The orbicularis oris muscle, which is this one, doesn't have any ability to really push down. It's like a sphincter kind of muscle that pulls against the teeth, and it gets modulated by muscles that pull it up in this direction. It doesn't have any muscle that really pulls it down. The muscles that pull down are attached to the commissure over here. So if somebody has really prominent teeth, their upper lip will just dangle over it. It won't be able to close all the way, and then the lower lip has to kind of push closed like that, and it causes something here called peau d'orange or orange peel, and then depression of the lateral mouth depressors. So if we wanted to Botox these to relax them, we could put the tiniest bit, maybe 1 unit there, 1 unit there, and that will allow the corner of the mouth to spring up. This is where we have to be super careful. This is the Depressor Labii Inferioris. If you hit that, that'll actually change the level of the lip, so it goes to a more elevated level. So that's an area that you have to be very careful with. And then if we're talking about the mentalis, there's a sulcus mentalis right here. This is the halfway point of the entire chin. I always inject at the lower portion of the chin, so the halfway point and down. If you go above that, people are going to have trouble closing their mouths. So that means that this area over here, this is the sulcus mentalis. This is your actual chin. You can inject the halfway point and down, not the halfway point and up. So that's Botox, and you want to do very, very small amounts there. It's a very sensitive area to equilibrium, so I advise caution to, injecting patients for the first time. You want to do like the smallest tiny touch. Now, the jaw is another area that's commonly injected, and if we look at the masseter comes all the way across from the zygoma to the zygomatic arch, all the way down to the gonial angle, and it inserts on the bottom side of the mandible right there. So the issues here I've seen are pretty simple. People inject up here for some reason. That's a weaker part of the mentalis, and overlying it is all your mimetic musculature, meaning all your zygomaticus, major, minor muscles. So you can really make someone smile asymmetric by doing that. So typically I go down into the belly of the muscle at the angle of the jaw. I have them clench. So I have them clench right here, and I push right down towards the bone, 5 units. I go to the anterior part of that belly, 5 units, posterior part of that belly, 5 units. So that's really all you have to do for that. Now, to the filler portion. So fillers can be placed all the way around here for the jawline. And this is something I want to kind of clarify for everybody, because I've been getting sent a lot of photos of patients who get these incredible jawlines by adding filler. And yes, it looks good in the photos, but the issue you're not seeing is a lot of these patients either get too much or it accumulates and they accumulate water, and it ends up looking like they have like a parotid gland tumor or a salivary gland tumor. It's our natural architecture is composed of bone and then covered with overlying muscle, skin, and soft tissues. When you add filler to this area, if you do a little tiny small amount here and there, it's nice. If you do too much, it starts to weigh it down. If you do way too much, you start to look like you have a parotid gland tumor. And I've seen this a lot where they really try to get too much out of it. So the main message there is just don't do too much. When you go and do fillers along the jawline, it's highest yield to do in the prejowl sulcus, which is the area in front of the jowls. So the jowl is kind of drooping of the face there, and then right in front of it you could put a little bit, and then behind in the jawline you could put a little to build it out, and there's different ways to do that. But you don't want to do too much. You don't want to make someone look like they have a parotid gland tumor, and people start carrying weight in their face, and it shows up in pictures. It's women start looking masculine and weighed down and heavy like they gained weight. So it's really, really not great. So other points to make about this: when we're injecting in this area, we're mainly going to inject on the periosteum, onto the bone. And that's because we're trying to increase the bony prominence, and that's a very high yield thing to do. Now, you don't want to go dumping 2 cc's or 2 milliliters at a time in there, because eventually what will happen is you'll get water retention in the skin, and the chin will become doughy. It'll become doughy, hyperelastic, and flexible. And if you've had a lot of filler, you'll probably start feeling like that. And it can actually affect it and expand it over time, where you start to get a witch's chin. When you smile, it goes down and it starts to look broad and masculine. That's the area that you want to inject directly onto the bone. And I usually use hyaluronic acid fillers for this. This in the prejowl sulcus, or the paramedian portion of the chin, you can go superficial or deep. The issue with going deep here is that it's fairly low yield on some patients. The other is that you can get vascular compromise. There's a bundle of vessels here that comes and goes inferiorly and superiorly, branches all around. And there have been several reports of people trying to inject near the bone there, and they end up hitting one of the outgoing vessels, and it can cause vascular compromise. So I tell people, here, inject onto the bone. Here, it's easiest to actually go directly subdermal, and you stop at the jowl. Here, laterally, you've got different ways you can do it. You can make somebody go wider, you can make somebody go more inferior, and you can make somebody go more lateral. So you can actually extend them in all directions. Typically, what I do for this portion, which is widening somebody, I go right down onto the bone, and I do small aliquots there to push the jaw outwards. And then what I'll do is I'll come superficially in this area to go subdermal and bring it posteriorly or inferiorly. You never want to go too far down away from what it's supposed to be. Again, it'll just start carrying water and getting heavy. And I always start here and then move my way back over there. So let's say you want to do filler over here or there. I personally do not love permanent fillers. Obviously, Bellafill, Artefill, silicone, they can cause a lot of problems. So I stay in the temporary realm. In the temporary realm, you've got your Radiesse, which is the calcium hydroxyapatite paste, and then you have your hyaluronic acid fillers is the main ones, and you have Sculptra. Sculptra is not going to do much for this stuff, so you're pretty much between Radiesse and the hyaluronic acid fillers. Radiesse I don't like in the soft tissues because it can calcify, it can draw in water, especially in these areas. It'll make somebody look very masculine if they're feminine, and it'll draw in water chronically, and you won't see it happening. So I don't like it. I like the hyaluronic acid fillers. Radiesse can be used on the bone if you wanted to, but again, if something goes wrong, what do you do? So hyaluronic acid fillers, here you can pretty much use anything. Back over here, you can use anything to pop it outwards. And then the cornering of it, I really like to use the smoother fillers. So Restylane Define is my favorite in the Restylane. And then Voluma is really nice in the Jupiter and Branches stuff. But you have to be very good at manipulating. The Define is kind of smooth, and it's really, really nice to use over there. I think that's it. Otherwise, I would say in general, when you're injecting filler around muscles, don't inject too much. You're going to draw water into the muscle eventually, and don't overfill the face. That's obvious. But here in the jawline, don't fall for all those photos. I mean, they might be real, but realize that even though the person looks amazing right away and they have the most defined jawline ever, they're going to start looking boggy and heavy later if you put too much. Fortunately, most doctors around here are pretty tasteful, so they don't do that. But there are some who are overly perfectionistic, and they want to get the best result possible, and they just go a little too far with fillers. There are very few, although they do exist, that just Photoshop the photo, and you're like, oh my God, how's that possible that they did that with a filler? And then ultimately it's not possible. In reality, it's only possible with Photoshop. So caution to looking at those, but realize that with fillers, there's always long-term sequelae or effects that you have to worry about. And even though they're not dangerous, things like looking like you have a parotid tumor are never sexy and nice. So that's all. I'm getting back to work before my office.